you are here after 2 months. I saw you 2 months back for some sinus issues. You've been dealing with it for some time.
Yes, sir.
Would you help us share your story as to what has been going on with your sinuses over the last few years?
Yes, I basically was diagnosed and struggled with several years. When I say several, 10 or more, with what they considered was chronic sinus issues, to the point to where I was very prone to get some pressure build up and then be diagnosed with some infection in the sinus cavities, as well as some earache, ear pain, and some ear infections.
Right. So 2 months back when I saw you, what were you doing about your sinuses at that time, lately over the last 1 year?
I had exceeded to the level of where I wasn't comfortable with having 3-4 sinus infections in a short period of time and medicating for them. So I actually went to a nose, ears, and throat specialist, at which time it was discussed with me being tested for allergies so they could pinpoint some of the allergens that were going on with me, and was then recommended that I take an allergy shot as often, to start with, as once a week. For an ongoing, there was no set period of time of how long I was going to have to do that. So I began the series of the shots, was on those for approximately 9 months.
And that's when we intervened,
right,
2 months back.
Right, and you intervened a couple months back. I can't say they didn't work or they did work. What I can tell you was it did not relieve or remove the issues I was still feeling within the pressure, and I wasn't really feeling as I was moving forward with much accomplishment.
Okay. Can you elaborate on your pressure? Like, where exactly was the pressure you used to feel?
Yes, I had a lot of pressure through, if I may, through the bridge of my nose, down under my eyes, and then I always felt like, and it would go down my ears, but I just felt like I carried into my whole head was hard to carry, if you will. And it was an intense pressures, which I would find myself doing this a lot, squeezing my nose, trying to get just a little relief from it when it was in the heightened aggravation times.
Right. So you were taking some allergy medicines too, apart from the shots?
Yes. Above and beyond that, I also had been prescribed and had done this for a period of time where I was taking a nasal spray, a steroid nasal spray, that was supposed to kind of maintain and offset some of the issues.
Okay. So last time, 2 months back, what did we talk about and what happened?
I came to you as my primary for an overall health check, and you, of course, are very thorough, and I appreciate that. And we got on the discussion of what was going on with me and with the allergies and how I felt about that, and where my points of pain really were, and what improvement I felt that I'd gained. And in our discussion, I really hadn't made much headway, and so we talked about doing something maybe different just to try it.
Yeah.
There was not going to be a loss in it.
Yep.
But maybe we could gain something.
Right.
I felt like I was really tensed up. I made the comment that my head just felt heavy, and at that point we talked about maybe intervening with some exercises, some stretch. I was a little bit apprehensive, but I have faith and trust in you. I knew it wasn't going to hurt me in any way.
Right.
But it may be something that would help with this process, and at that time I hadn't made a decision on whether I should keep taking the allergy shots or if I could get some relief this way. And at that time you introduced me to some neck exercises that have just been marvelous.
Okay.
I have made great strides.
Okay. Can you show us which exercises did you do?
At first, when you wrote on to me, you asked me, and being a little bit claustrophobic, I was a little bit hesitant, but my trust is there, or I wouldn't be your patient, to basically set up straight.
Right. And
at that time, you put your hand kind of over my neck and asked me to stretch it back as far as I could, in a comfortable position, but yet a bit of a strained position for me.
Right.
So I did that, and you showed me to make sure I was doing it correctly.
Right.
And you did it for a brief amount of time, and you held it back.
Right.
And tucked in the chin. and just asked me to breathe normally, and you did it for a short period of time, and then you said, I'd like to do it again with your permission, and I'd like to hold it in position and just breathe normally, but let me do this for a short period of time for you to grasp the concept and for you to see what may happen.
Right.
So once again, you did that.
Right.
Had it set back. I was breathing, and to my surprise, I could breathe, felt as if I could breathe deeper and with less effort, and I had a great relief of the weight, I guess I'm a big head, of the weight of my head. I just felt some real relief go through the back of my neck and my shoulders, and I just felt refreshed.
Right. So what about the sinus congestion or stuffiness when we did that?
It removed at that time.
Okay.
And that for sure.
And that's how we determine that we are getting a mechanical response. And so you carried on with those exercises?
Yes, we discussed it, and you made sure I was doing it properly, and gave me an opportunity to do it a few times so that you could observe. And I don't want to say I mastered it, but I think I did pretty good.
Yeah.
And so we discussed that I would continue to do that, and you did leave it up to me how I wanted to proceed with allergy shots or what I felt was doing the best for me as the individual.
Right.
I did them for about a week and a half. Continued to feel like not only did I feel the pressure just going away, but I felt more refreshed, more relaxed, to where I even started stretching other body parts. But I made the decision to call and cancel my continuation with the allergy shots. I don't foresee going back to those at any time.
So over the last 6 weeks, I would imagine you have not taken any allergy shots, right?
No, sir.
Okay. And so how are you doing with your sinus congestion and stuffiness and your quote-unquote allergies?
I've never felt better. We went through the summer. I spend a lot of time in the water, which if you go underwater and you hold your breath and you breathe underwater, or you swim underwater, you know, you're dealing with your nose, your throat, your ears. And I have religiously done the exercises and the controlled breathing. And I'm happy to say I don't think I've ever been able to breathe better and been more relaxed.
Oh, okay. Awesome. That's cool. So you are doing good without any medicines, right?
Correct. And I feel like I'm in control of this journey. And if I start feeling some pressure coming on, I relate some to stress. We all have our stressors. Then I will stop and consciously make the effort to stretch myself out along with the breathing. And I'm right back on track.
Cool. Did you make, we also talked about some posture. Did you?
Yes. Right. You were gracious enough I became a sloucher, if you will. The abdominal muscles aren't what they used to be. I know they're in there, but they're not showing like they used to. So I've made some adjustment in my posture, the way I just begin to sit down with my back completely up against, and my buttocks, if you will, up to the back of the surface I'm sitting on, setting up straighter. Taking, and it's not a noticeable like I'm at a workout, but taking some deeper breaths, exhaling, bringing what I'm working on to me, where I used to just, in a hurry, convenience, would lean over and spend a lot of time there and writing and such. I've made a conscious decision, which now is becoming the norm, to set up straight. My driver's seat in my automobiles, I also have a lumbar support, but it's not always readily available. But my automobiles, where my seat used to set, my driver's seat side angle like this. It's now positioned straight up with a sturdy surface, with my buttocks at the back of the seat, my shoulders pushed back, my steering wheel where it's comfortable. And I don't believe I'd be able to drive any other way at this point.
Oh, awesome. So you really worked on posture. That's cool.
And I'm going to continue to work on it because I'm a creature of habit. And the only person who's going to take care of you is you.
Yes, that's how it works. So, just a thought. So, are you surprised sitting here 2 months later that
I'm
something
grateful.
like,
I made the comment when you wanted to do that and basically had your hand somewhat over my mouth, protected to hold me back there. You know, I am claustrophobic.
Right.
You know, I didn't think I had anything to lose, but I was apprehensive.
Right.
And when we broke it down and realized that what I truly believe was more of a neck issue than a nose issue,
Right.
that was an eye-opener.
Yeah.
It was an eye-opener for me.